My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So another question is whether or not you're healthy enough to have rhinoplasty. You know, most rhinoplasty patients are fairly young. The typical age range is from sort of 15 to 50. And on average, I think it's very unlikely that you have any health conditions that preclude you from having this type of surgery. The things that would prevent you, though, are the need for being on blood thinners. So if you have to take a blood thinner for a clotting disorder or something like that, you really shouldn't have rhinoplasty. The nose is a very vascular structure. We don't want you to have excessive bleeding because you need to take blood thinners. Some of the other health conditions that don't necessarily prevent you from having surgery but might delay the procedure are having low hemoglobin. Some of our female patients may be slightly anemic. You can get some bleeding after rhinoplasty, so we want to make sure that your hemoglobin and iron levels are normal prior to surgery, and sometimes that requires a blood test before we can book your surgery. Obviously, you can't have surgery when you're pregnant, but otherwise most of our patients are healthy enough to have this. Just keep in mind that this is an elective procedure. We want your risk to be zero. So any health conditions that would increase the risk of having an anesthetic or increase the risk of bleeding are reasons to not have this surgery. So most people don't have health concerns that are risky. I think what's more important with rhinoplasty are what are the potential cosmetic complications of the surgery, and that is something we'll talk about even further.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.